All right. What's up, guys? Good morning, everybody. Good morning. Happy Thursday. Hope you guys having a great week. Hope you guys having a great week. How you doing, Charles?
Hanging in there. It's a beautiful day in the neighborhood. It's a beautiful day in the neighborhood. It's a beautiful day in the neighborhood.
Well, mahalo for joining in, everybody. Again, tonight we have an interesting show. We got some employees of the hotel industry. They'll be jumping on in a few minutes. We got Tyson Moises from the Grand Hyatt here on Kauai. Rhonda Morris, also from the Grand Hyatt, she'll be joining us. She works till 7, so she'll be jumping on late. She's always a blast. And then we have a gentleman that works at the Aqua Palms in Waikiki, just outside of Waikiki. And we're just gonna have a discussion, man. Again, like I said, a fireside chat without the fire. Just trying to figure out what these employees think, how they're reacting or working with the virus, with the visitors coming in. And I know I don't have to warn you guys. You know, this is not about you guys. Hey, what's up, Russ? Long time no see. And yeah, we're just gonna have a discussion and try to see how things are going in the hotels. How they're managing, how's the safety protocols. I want to know what's their position on Charlie. I got to tell you, man. I watched the segment on the news tonight. I think it was KITV, and they were talking about the 2 fake vaccination cards.
Yeah, there was Chung, the last name. Chung or Chong.
Yeah, father and son.
Yeah.
And that one of the comments was, after these 2 people got arrested, it became clear that it's not very difficult to falsify these cards. People, we have been saying forever, again, the message, oh, no, we got to rely on the honor system because nobody going to fake one card knowing that it's a federal violation and that blah, blah, blah. Guys, I mean, just ask anybody that works in the liquor department or ask any police officer how many fake IDs, I guess, is probably much more rampant than fake driver's licenses, but fake IDs. It's what would make this any different, right? So, again, I'm getting really aggravated with this unsafe travels program because the government, our governor, our lieutenant governor, and everybody will not admit that unsafe travels program is not safe. They're not. They're going to their graves saying that it's working, and we know it's not working. And it's not just visitors. It's all travelers. So. Why is Green asking us to hang on for a decline in cases in 3 weeks? Is he using a crystal ball? Yeah, his crystal ball is, you got to change the batteries because it's not working. I don't think 3 weeks. It's not going to be in 3 weeks. As we see, the cases are rising, right? I mean, and what's troubling is the cases that are in the schools. Appreciate all of y'all that have received letters from the DOE or from your schools that you share it with everybody, because I think it's important that the public, whether we have children in school or not, that we have a good snapshot of what's really happening in our schools. We know for a fact that this is going to spread. We were forewarned that this was going to happen if we don't be careful, and we haven't been careful, and the numbers are rising. So I until they make some changes to the unsafe travels program, I'm afraid that we're not going to see the decline that the lieutenant governor is saying is going to happen in 3 weeks. It's just not. It's not going to happen. We're gonna take on our hotel employees and see what they think.
Well, it's interesting that and it gets frustrating at times to think why certain leaders think the way they do and why they say the things that they say. And the only way things going to happen is, and I always that's I say the same thing over and over again. Like the way things are done, I think we just gotta hold on just for a little bit more. 2022 is right around the corner. But let's look at what we have done. Let's look at what we're still doing, and yet we're being asked over and over again to do more. And if we and I don't think anybody's keeping track that if we do these things and you still have growth in infection, then you got to tell yourself, okay, what more can we do? Just short of learning how to fly and stay aloft so we don't get tagged by this virus, right? But being realistic about this whole matter, it's we've done everything that we could do, and they still ask more of us. All we're saying is just try holding off in allowing so many come in. Why don't you just try limiting the amount coming in? And I know it can't be done, but let's try re-implementing the second test again. Let's just do it and see how it works. And if in 3 weeks I'm wrong, then I'm wrong. But hey, it's then we'll know never to do that again, right? That's what you can say, but you won't know until you try it. And these guys just don't want to try it. We have data that shows it was tried before and it worked. Why they don't want to go back to it? Anybody's guess.
Yeah, well, I think we know why, and you said it at the end of your comments about we know it works. We know it will work to cut this number. We absolutely know.
Yep.
And it's not a lockdown in the sense that the stay at home or this new thing that just passed yesterday is not going to do much. It's not the change is not going to affect the or it's not going to stop this virus. It's not. I mean, really nothing changed. If you think about it, nothing changed, right? Bars, restaurants, blah, blah, blah. They can go to 50%. Well, most people already are doing the 50%, and that has been been told over and over by people in the industry. This whole thing, you saw the thing I posted about the concerts in Honolulu, the symphony, the orchestra. They're not stopping. And I found out today the way this works is if you have an event for Kauai that is over 100 people, you can still have the event. You just got to require everyone to be vaccinated or have a negative COVID test within 24 hours of the event. Well, we know that it's gonna have some effect, but when this virus is being spread by vaccinated people, I don't understand why it's like nothing will change because we're not touching the incoming viruses, the new virus, the new infections that are coming in via the aircraft, the airplane. And our airplanes are full to the gills. It's sold out. Scotty says go back to the vacant middle seat. That may help some. But I think if we don't identify the virus and isolate the virus that comes into our state, then we're going to continue to have spread. You cannot get around that. And if we don't want the lockdown, when I talk about the personal lockdown, I'm talking about yourself acting as if there was a lockdown, going out only when you have to, going to the store when you have to, and protecting your your family and your loved ones. But if we're not going to address the incoming visitors, then I can promise you we're going to hit one lockdown like no one wants another lockdown. No one wants a stay-at-home order. But you cannot have your cake and eat it too. So it's either are we going to really drastically cut the surge and implementing the unsafe travel program, amending that so we will have that second test. And the last time, Charlie, and I'm curious to hear from our hotel people, we had the bubble concept, right? But the bubble concept was only limited to the high-priced hotels, the resorts. And why can't the local Kauai Shores or Pono Kai is the other, why aren't they allowed? If you keep these visitors within a confined area, and you test them, we're gonna find out, we're gonna find the positives. We're gonna find the infections. So the businesses doesn't have to suffer. Will there be a decline? There might be. Enough to shut down the whole economy? No. But if we don't get a handle of it, we already know what's happening in the hospitals. It's at a crisis level. The governor will have no choice at that point to put everybody in their homes again. I know people don't want that, but just think of this for a second. For those of you that says no lockdown, blah, blah, blah. Think of it if it's your child or your parent or your spouse that has to go to the hospital for whatever reason, COVID, non-COVID, doesn't matter. And they don't have rooms. They don't have personnel. You're gonna be very upset. You're gonna be upset. So, hey, Jenny, any property could have applied. I thought there were some restrictions as far as you needed a kitchen and you needed to be able to provide food. So if I'm wrong, I stand corrected. I misspoke. I was under the impression that you had to meet certain requirements to be a bubble resort. So if that's available, then I think, you know, the hotels need to take advantage. But, you know, not confining them to the room, but allowing them to enjoy your property. But what else we're going to do? Seriously, what else are we going to do to stop this surge? We're going to just keep begging people to get vaccinated? We're going to just keep blaming the local people for gatherings? It's not going to work. We'll give away trips to Vegas? Really? That's not working. So we gotta. This is the analogy I use, Charlie. Let's say you had diarrhea, right? Let's say last month you had diarrhea. You went to the store, you bought Imodium, and it took the first couple pills, and you were done. Diarrhea is gone. It worked. And then a month or two later, you get diarrhea again. Why would you not do what you did the last time to stop the diarrhea? Well, you're gonna try something new, maybe prune juice. Yeah, Mel gonna tell you, hey, Charlie, try the prune juice. You know what I'm saying? We know what we gotta do, and we don't have to do it all one time. But let's take portions of what we did and start implementing those so we can stop this freaking spikes. Hospitals are full, people. Hospitals are full. And look, yesterday 263 hospitalized, today 282. We cannot take much more of this. Cannot take much more of this. Anyway,
Well,
that was my rant for the evening.
I see a lot of, I don't know, it's what's happening now goes against common sense, goes against learning beliefs, because if we believe in sending our children to school to learn and they retain and they act upon what they learn, then they're just that much more ahead in life. But we as adults, what we're showing them right now is that we learned some things new last year leading up to this point. What we learned and what we know that worked, we don't want to do that. And so these young children just look at that as saying, well, if adults are going to do that, then we might as well do that too. That's a possibility. And we don't want that.
Well, what upsets me is if we had gradually done what we should have been doing 2 to 3 weeks ago, 2 to 3 weeks ago, if we had started the implementation of these measures, we wouldn't be at the 600 a day, 700 or whatever it's going to be. You know, we would have been much in a much better place. But because we kicked the can down the road, now the can is at the end of the road against the curb, cannot go no more. And now we got to take some interesting measures. Okay, let's see why my friend Tyson is not coming in here.
He's on right now.
Oh, okay.
He has
There
a
he
mic
is.
too. Yeah.
All right. Can you see me?
All right. Hey, put the kids away. If you're offended by foul and blunt language, you might want to turn your channel to Sesame Street. I don't know. This is Tyson Moises. He works at the Grand Hyatt Resort. Or I don't even know what the real name is. Grand Hyatt Resort and Spa or whatever it is. What is the true name of that place?
It is Grand Hyatt Resort and Spa, my friends.
Bingo. I got it. I
What,
got it.
what's going on, uncles?
Well, you see Uncle Charlie just sit back in his chair. He's ordering his popcorn, and he's just gonna enjoy the show, man. He's gonna enjoy the show. We got a ton of people on already, and Tyson came to me a few weeks ago and said, "Hey, Mel, what about bringing some hotel people, employees from local hotels from the state, not just Kauai, but around the state, and we just talk story." I said, "That's a great idea. You set it up, we'll make it happen." And he did. He got a gentleman from the Big Island, but with the changes in the restrictions, that he got called back to work. So Tyson, being the coach and sports guy that he is, found a replacement, called up the second string. I hate to say that because, but anyway, he was able to get an employee from Oahu, from the Aqua Palms Hotel, and then of course Rhonda. Rhonda, I know she's working till 7, so we get some time before Rhonda comes on. I don't know how much time, but we got to take advantage of that quiet time before Rhonda.
Yeah, we got a little bit of silence without her for a little while because I'm the quiet one.
Anyway, Tyson, mahalo for coming on. What's happening, man? You see everything, local boy, Kauai, Kalaheo, living up in the Mauna.
Not much.
Beautiful.
It's funny if you clicked on my feed when I joined about 3 minutes earlier, I'm laughing because when you started talking about diarrhea, I just got off the phone with a friend of mine talking about cases with the kids, and his wife was, I don't know if I let my kids leave the house. I was like, you can't shelter them. I said, we got to figure out ways to work with this. But so I gave him my analogy. I said, all of us walking around, we're just toilet paper. So we're toilet paper in a chef storm. That's all it is, right? And for a few, your protection, some of you 3-ply, some 2-ply, some of you real thin. You get your vaccination, you might be 3-ply, right? Now, for those that the 1-ply, you don't got to worry about sanitizing your hands and all this stuff, because no matter what, when the shit hit your toilet paper, it can go straight to your hands. You can just keep getting dirty. So I said, no, I said, just be the 3-ply. We're gonna be all good.
I told you guys, put the kids away. Put the kids away. Everybody knows our show is uncensored, unrehearsed, unscripted. So again, if you find this offensive, I apologize. And
no worry, it won't be offensive. We're gonna have fun. But somebody did this. I think it was Marriott asked, which Hyatt? Grand Hyatt Kauai, beautiful Garden Island. We only got 3. Well, we got 4 Hyatts in the state. No, I take that back. 5, 6, 2 on Maui, 3 Oahu, and then we got us. Nothing on the Big Island. So, but the one that me and Rhonda work at is the Grand Hyatt Kauai Resort and Spa in beautiful Poipu, Kauai.
Well, let's start, Tyson. About a year and a half ago, when everything really happened, when COVID became a thing, and no one really knew what to do. Rightfully so. This is a brand new virus. No one knows anything about it. We're watching what's happening in other countries and what's happening in the United States, the continent, and then then it hits the shores, and all of a sudden things happen. Yeah. Take us through that journey in a very quick way from then till now.
Well, for us, and if people don't know, I work at the 7-star valet at the Hyatt. But early on, when we started getting these restrictions, well, actually, we didn't really get to the restrictions of travels. We just had people stop traveling. So this was late February, early March. And when the hotel started losing occupancy, we've always been, a bad year for us is an average of 89% in the 30 years we've been open. And when they started seeing the occupancy start dropping, they said, okay, you know what? We don't need certain departments right now. So easiest one to cut are small departments. And we're not a very large department. Valet, we got total with our valet attendants, clerks, and the doorman. We have 13 people. So what they decided to say, you know what, we're going to shut you guys down temporarily. Now, remember, this is early on. This is March. I think they barely started testing for COVID-19. So we had a department meeting with the execs, and they said, "Hey, we're gonna shut you guys down March 20th. What was it? March 26th was actually for us. March 26th, we're gonna be done, and it's gonna last through April. All right, you know, all the things they talk about medical, these things, because everybody's big concern. Obviously, it was a health pandemic. What about our medical? So they talked to us about the medical boom. So it was us, and I believe it was either Grand Club or the Spa. They shut down. We're the only ones that are going to shut down initially. And this within about a 7-day span. This is before I was at Home Depot, and you jumped on in your impromptu Facebook Live and was going crazy.
March 26th.
Yeah. So this was that. Was that the 26th? That happened? It was a Sunday, right? Wasn't it a Sunday?
I forget the day, but I believe it was a day that the governor made his first press conference about the travel quarantine.
Thank you for watching, by the way. Thank you. And so when we were set, okay, we had a meeting, we're going to shut down. And then when he put in all those travel restrictions, it went from, okay, it's not just going to be you folks. We're shutting down the entire hotel 3 days after the original do it. So I think our last day of operation was the 27th. And I actually worked, since we're already going, I worked that morning prior to our shutdown. We're at 1% occupancy. I've never seen that. So we're like, okay, you know, and prior to this, you know, when we're hearing all these things going on the news, whatever media outlet, right? I don't care what you watch. It was all the same thing. We're starting to see growth in the virus amongst all 50 states. All right. So I told some of my coworkers, I said, you know what we got to do as a nation? Shut everything freaking down. They go, what do you mean shut down? I said, shut everything. At the time, you know, the early on was 14-day incubation period. I said, 14 days, you freaking shut everything down. I said, the only people allowed to go anywhere is first responders. You tell them, okay, you got till whatever, pick a date, Saturday, midnight. Go get your supplies for 14 days. You're not allowed to leave your property. If you're in a housing complex, you stay in there. You leave, you get severe consequences, arrested, big fines, whatever it is. And then after the 14 days, you have people, if you're feeling ill, contact, you go check. And like I said, testing early on. But now we would have been able to kind of centralize, okay, we got some illness here. Let's go take a look. My coworkers are like, dude, you freaking insane. I go, why? They go, no way they're going to shut down everything. And my whole thinking at the time was, we could already see the start of the economic hardship. I said, do we want a short-term hit, or is this going to be elongated? And at the time, short-term, I was thinking, maybe, you know, a month or two. And elongated would be, you know, this is March. Maybe come winter, the ending of the year will be fine. They're like, Brad, there's no way you can do that. You know, it's easy hindsight 2020, but if we could have done something similar to that, I'm not saying it would have come. I think shutting everything down immediately would have probably helped, you know, being a little proactive, but you know, it wouldn't have been the easiest thing in the world. You would have to need every single state, federal, local, whatever it is to coordinate and be on board. But I don't know, you know, as we know, right now, we're just toilet paper.
Well, you know, many countries did that, exactly that. But they were able to do that because, you know, they're one country, boom, and they were able to shut the borders down, shut everything down, put everybody, you know, in somewhat a quarantine status. And they basically got rid of the virus until the next, you know, then you slowly open up, you get it again, and they got to do it one more time. So you're right. I think you're right, Tyson. I think at that time, if you were serious about stopping, remember, giving them the benefit of the doubt. They really didn't know. They should have, but they didn't know. They pretended like they didn't know the power of this virus. And so that little shutdown, or not shutdown, that little temporary layoff lasted quite a while for you, right?
Yeah, you know, and when that happened, right, everybody said, I mean, now, you know, at the federal level, they started working on things. You know, the first one was the American Rescue was the same. What was the first one? The first relief plan?
It was, I forget what they called it. It was
I already forgot. I need to think by heart. But so what happened was as we shut
Stimulus,
down.
stimulus package 1 and
Yeah, I
stimulus
forget what
package
the
2.
first one. Whatever the hell it was. Something care, I think. Wasn't carrying it, but who gives a crap? That's neither here nor there anymore. But anyway, for us, so we were like, okay, you know what? We don't know how long we're gonna get shut down right now. All right. So, but initially all that federal unemployment assistance, which let's not even get into the unemployment portion. We're like, okay, we got till July at the time. Okay. If we can curb it, and for us on Kauai, we knew initially we'll be fine, right? Hawaii kind of in general, and more so here on Kauai, and yes, I'm a lot biased because I'm born and raised here. We take care of one another. We are the ones that got our asses freaking slammed by hurricanes for the last 30 years. We always took care of our neighbors, whomever it may have been. So I kind of knew here we're doing, but when you're in the hospitality industry and you rely on travelers coming in and out, it's not what goes down on Maui, Big Island, Oahu, and here it's what's going on in foreign areas, domestic places. So like, okay, if they can kind of, get it together, maybe by the end. Oh, CARES Act. Thank you, Melissa. I saw that CARES Act fund. Mahalos. If they can get it together, maybe by the time July, where a lot of us who were like, damn, we got no job. Okay, this additional money is helping us, but it's not what you want to live on or depend on. If we can get back by July when that runs out, we would have survived, the early monsoon. And as things kept going, and then you start seeing things going, then more so you had international airports and countries saying, we don't want anybody from the US coming in, right? It's like, oh, okay, they're not even getting travel. How are we going to start traveling up again? And then it just became a, what now? What are we waiting for? We don't know what's going to happen. So it came more of what if? And we all know if all you think about what if is basically like having hope as a strategy. That shit don't work.
So when you guys get the call to come back, by the way, what is your guys' occupancy now?
Oh shoot, I'm off Wednesday, Thursdays. Last day I was in, we dipped a little to 89%.
Oh, okay.
So when we reopened April 5th, that's when we came in. We opened up the exact same day we re-entered the whatever you want to call it, Safe Travels program. We started off at like 15%. By the ending of April, we were already up to 40-50%. But by the ending of May, we were already 80+%. We haven't been below 80%. At least we haven't averaged under that since May. So we've averaged 88, 89% and whatnot. And it's like we've always said, nobody's got to sell Hawaii. People will come. It's now, what is the preventative measures to keep allowing people not just to come here, but residents to leave and then come, right? Because when Safe Travels reopened, when we came in, guess what? It allowed residents to leave, and I know a whole bunch of people that said, oh shit, I can get off the island and let me go. So it's what happened when we had Safe Travels come into play. Everybody could come and go as they pleased. But yeah, so it was we're still busy, and we're still busy right now.
Well, let me ask you and it doesn't seem like to be slowing down at all, right? Just more people just keep on coming.
Uncle Charlie, you want to know when we see a little dip in occupancy at the Grand Hyatt?
When?
Next March.
Oh. Let me ask. Oh, go ahead, Charlie.
The reason I say that because some people said, "Nah, Mel and I, we didn't know what we were talking about when they said that the visitor rate will take a while to rebound." And we kept on saying, and then as it was going, we already knew some places wasn't even prepared for the influx the way it was going to happen. Because why? No cars, right? Eateries not 200 wasn't to full capacity, not enough food in the stores. We saw all of that happen. So, it was already a thing of like, who trying to fool who? The thing is, we had to live with all that shenanigans. And so that's why now, instead of embracing what we have now and to be blessed with what we have now, there are some, and I have to err on the side of caution when I say this, but there are many that just downright frustrated because there was no there was no protocol in place to say, hey, it's like when you have a bunch of wild animals, right? If you're gonna let them out on the range, let's do it a little at a time. So the first group get acclimated, so they don't turn around and come back and try kill off any more that we letting out, right? They just said open the floodgates and just see how everybody gonna handle. Okay, I get it, but then we're also starting to infect more people at the same time, and we're not doing a very good job at controlling it. So what do we do? And this is one time that I have to say, in all honesty, that I am afraid because I like to be a realist, right? You get sick because I know I was sick when I had my open heart condition, and I had to know that in 6 months' time on my recovery, I had to do certain things to show that I can actually take care of myself. And I was real to the point, and I did it because why? Because I wanted to live. How people are acting nowadays, like, yeah, there's no tomorrow. And that's what I'm worried about. That's what I'm worried about.
That's what I really observe, right? Because like same thing like when we're coaching, we tell kids, especially baseball, you can't control what the other player or team's gonna do. And what you just said right now is we can't control what someone else does. We gotta try and do our best to see what we can do, protect ourselves from others, but still know some of these damn Pukas just don't give a crap about others. So they come in. And sorry, just to answer, somebody asked what type of clientele we get. I gotta be very honest, and I tell this all the time to people. At the Grand Hyatt, it's not friggin' a Holiday Inn price that you're coming into. So our clientele is not that cheap thrill. Let me get that $100 round trip, and I just going to Hawaii to freaking dick around, right? Our people, they come in, and a lot of our people that came, it was return guests that just missed coming to not just Kauai, but the Grand Hyatt, just to see a lot of the employees they met over the years, became friends. So our clientele, on the most part, they're pretty good at being cautious and respecting the island. You still can get those dumbasses that just don't care. Like, I'm paying all this money, let me go. And somebody asked, what's the rates like? It's not cheap. I think, like I said, this year, I mean, this month, maybe we dipped the average room price was like $989. You know what I mean? That's $989. You're not going to be coming for a little cheap thrill for that kind of pricing.
Okay, let's be perfectly clear out there, folks. It's not $9.89 he's
Oh,
referring to.
I thought it was $9.80. I just told Patsy book us 2 weeks. Oh, it's not $9.89.
No.
And I think it might have been, I forget who asked that question, because they asked if we had the Walmart
Blue Light
customers coming in, which is good because now that we're gonna have Target opening up, we gotta keep in mind Target is great. You know, they got great variety and all that, but they ain't cheap. So I guess we can control that one right there. And then I think might have been Dana. I saw her ask, what are we doing with larger groups or any events? And as of right now, we haven't had any large ones. We're gonna have some this fall, but we're gonna see now, right? Because we're getting restrictions coming into play. And funny one here, since we kind of talk about the groups and restaurants, last night I mentioned I had a good story about restaurant maximum capacities 50 and 75%. Just to let people know, 50 and 75%, it's the same freaking thing. It means that if you're separating by 6 feet, most places can't suffice expanding seats along with that space. But our whenever we move to tier 5, I don't know, what was it in July sometime? We're going from 4 to 5, and our case counts are super low as it always was. And we had leadership at our hotel that inquired about more so an exemption space-wise. And I don't even know if it was an exemption. It was more of a question thinking, saying, if we go to 75%, it doesn't change anything from us from 50% because we're separating by 6 feet. And I'm not going to mention any specific name, but a person in a position of leadership that makes decisions on the island said, wait, you guys are separating by 6 feet? I didn't even think people were following that. The freak were we freaking making those rules if people ain't going to follow it?
That's why we like you, Tyson. That's why we really, of course, when comments like that just make my blood pressure rise, and I gotta take a sip of my coffee just so I can get them a little higher. But I wanted to ask you, and we'll come back to that, but because you brought up something about your guests. What percentage, and this is not a Hyatt, this is a Grand Hyatt, so it's a step above, but what percentage of guests, generally speaking, are return? It's people that basically come back every year to come back to enjoy, and this is pre-pandemic.
Yeah. I would say those that come annually, honestly, it's a good 30 to 40%.
Okay, which is a good chunk. That's a very good chunk.
A chunk, right? Because I've been there 15 years, and I've seen toddlers that are now teenagers, and then those young adolescents who they're adults. So you get a lot of those that repeat and come.
And then from when we went from when we opened up with you guys were one of the bubble resorts. What was the occupancy with the bubble resorts? You remember what that was?
Oh man, don't get me started. The bubble resort, we never operated as a bubble resort. We put in an application, we got approved, and when we would have went into effect, that's when we got the rug pulled out from under us. And when I say the rug pulled out from under us was when we opted out of the Safe Travels program. And I told you this before. I told this to our county officials straight. I said I was never upset that we pulled out or opted out in December. Oh no, sorry, I take that back. I was never upset that we opted out. I understood why they opted out. I was mad, not lies. I was an angry little elf for like a month. I was pissed off that we opted out in December. Because the same concerns we had in November when we reopened, allowed people in, were the same concerns that were existing come December. So I was thinking, just why did we reopen? You gave a lot of businesses hope you can reopen safely, spend all this money, employees can get another foot in the door, maybe we can get stability again, and then boom, we're going back out. And then I got upset about that because now we had no guidelines or benchmarks as to when we would ever reopen. It was like I could wake up in the morning if I'm a decision maker and say, hey, it's sunny today. We'll keep all restrictions and travel restrictions in place, blah blah blah. So it went back to the waiting game. But the bubble resort, your original question, the only way a bubble resort can be successful is they got to be open and operating. Like I said, we're shut down. I know now if you talk to somebody maybe at KBR, probably they got a different perception because when they operated, they were getting slammed, right? So they went. I always thought the bubble resort was a good idea if you were able to open up enough of the hotel to be successful. And yes, it does come down to money. Nobody opens a business to freaking go broke and be poor. But like for us, honestly, we never would have survived as a bubble resort. I
could have sworn you guys were a bubble resort. I thought your hotel was always in the. Whenever people talked about, I swear I thought the Grand Hyatt was a bubble resort.
Funny timeline. We on the news they showed the 7. I think originally we had 7 hotels here and 7 hotels and resorts that got approved. On that Monday, they announced it. That Monday morning, they announced we're a bubble resort. Monday lunchtime, we all, staff there got our high text message saying we're shutting down on Thursday. So the bubble resort, we never operate as a bubble resort.
So during that time, you weren't open at all?
Nope, we opened for the month of November when we re-entered the Safe Travels program, but we just opened up as normal, with all the safety protocols. I said this back then, I say this still today. Coming onto our property, it's cleaner and safer coming on our property than it is walking to Walmart, because you got sanitizing stations all over the place. We still have a mask mandate when you're indoors under any covering. But with a lot of states not having that mask mandate, people just forget. And like we've had a handful of people that were, call them what you want, Karens and Kens, that start bitching out at you for no good reason. But most people just literally forget because their states just don't do it. So they got the mask with them. They just forget as they go walking in, or if they get real close to somebody, they just kind of forget about it. So, you remind them, and most of them is good. But like I said, we got pretty decent clientele that come in all the time.
T, let me ask you a question. Like you, I work in an occupation now that I see hundreds and maybe thousands of people a day. Close proximity coming, and that's our beautiful Lehue Airport. So my question to you is, why do you think travelers coming here, and I can't say where they're from, first of all, because we don't know unless they come out with a big shirt that says, I'm from Timbuktu. Okay, fine, you're from Timbuktu. But they come here and they just have a total disregard for just like simple things like, every so many minutes is, all you hear over the overhead is like a welcome to Hawaii. We have a government issue mask mandate. It's blaring. And my office is right there. And I hear that every single day, to the point that I literally go into a hypnotic trance. I wanted to find out from you, working in the industry, what's your take on why people really, the ones that you've seen, don't wear masks? They just have no cares in the world. Why is that?
It's twofold. Some think because they're vaccinated, they're good to go. Once again, we all know that's horse crap, right? Yes, it gives you that layer of protection. Once again, right? You get the vaccination, you're 3-ply toilet paper. And then you get the others who, we got them here on Kauai. We got them all over the place that just, they don't care. Like, hey, you're not taking away my freedom and all of this. Dude, nobody's taking away your freedom. Like, just wear a mask. If it's required to wear a mask, wear the mask. But I think it comes down to, a lot of times, people caring more about what other people are doing rather than just caring for themselves. But it's interesting to observe the different types of attitudes, personalities, and characteristics of people from different areas of not just the United States, but even different countries that have been making it on in. And sorry, just because I saw this, Dana asked if they are testing our employees regularly. No, every Monday, Wednesday, and Friday, they got free testing if anybody wants to get tested. But that kind of goes in how I said about coming to a lot of people I read over the months talk about how I feel sorry for hotel workers. They're just pawns, this and that, BS, blah, 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 blah. We're not pawns. What your property or hotel does goes a lot to say how safe it is for employees. Like I said earlier, we've been basically 90% since May. We've got about 700 employees that's been working back regularly. And since we've reopened, you know how many employees have tested positive and contracted the virus while working? It's the same amount of inches I've grown in the last 22 years. 0. All right. So,
Yes.
so our people, they freely, if they feel they're sick, any employee can go in anytime and get tested. So it's readily available, but they don't require anybody to get a test right now.
So your testing is on site, right there at the hotel. You can go get a test.
It's on site. We got a nurse that comes in to administer it. I believe it's 9 to 12 every Monday, Wednesday, Friday.
Awesome.
So, looking at today's report of Kauai County, 50 cases. Back when this all started, 50 cases, it was like, shut down, shut down, shut down. Right now, it's like, eh, we see what tomorrow lies. You know, I always get stuck with trying to find out what is that threshold that will initiate the worst that can happen to us, right? Because, say, for instance, they always use the magic number 9. We have 9 ICU beds. I have a real hard time believing that because I've worked at the hospital before. I had the security contract there. I know one of the hospitals that I worked at, they themselves had 4 beds, one, two, three, actually 5 beds. So you cannot tell me that the other major hospital in downtown Lihui has only 4 beds. So that's, to me, I think those are all contributing factors of why people just don't want to follow rules sometimes because it says, hey, we're being misled right from the get-go. And being on this show for nearly a year and a half, right? We're doing this. I have to tend to agree with them because we've been listening to a lot of hogwash. And I said, gee, why can't you just give them the real scoop and let the people make up their minds? Why do you try and go do all this hogwash for what? What's the purpose? What's the purpose? Where will it get you? And so I'm at the point now that okay, there's this real concern about the schools and the children. Okay, got it. When this outbreak first happened, you hardly had any cases in the school. Now it's almost a commonplace to have cases. Is the DOE not concerned about that? Are they banking on the fact that these kids are young and they can outride the storm? I hope they're not thinking that way because you know what? When somebody gets into the real dangerous level, it's too late to be the shoulda, coulda, woulda. It's too late. And I think a lot of those things is what really bothering me right now. Because it's like this role, right? You had Mayor Blanchard, you had our lieutenant governor, you even had our governor at times, you had Mitch Roth. They weren't going to do anything out of the ordinary to throw all of these travel visitors or travelers. They weren't going to do anything to throw them off kilter. And that's why they kept on saying, yeah, we know the numbers are high, but that doesn't warrant us for close down. Okay, fine. Then why are you taking drastic measures now? Tell me, why are you taking drastic measures now? If you're saying that, would it have been better if you did it a couple months back when we knew about how much devastation was caused by this variant in other places of the world? Wouldn't it have been better for us to be prepared? And like now we're in the thick of things and we go, oh boy, right? And you notice when they come on the TV, they have this look like, mommy, mommy, help, please. That's the look they have. Am I
Well,
am I kind of am I kind of near the ballpark at what I'm saying, or I'm
no, no, hey, you're correct. It's like I don't know if it was last night or the other night, how you guys did when LG Green, they're at the hospitals now, doing all of this, trying to clear the case. You guys said for months, guys, go there now. It's gonna go. Like a lot of people think because I work in hospitality, I'm against testing, I'm against all these type of things. I don't know. Of course you gotta test. You gotta protect things. You gotta try and minimize, you know, how much shit's gonna hit the fan, right? And going back to your other thing about numbers, I'm not gonna lie, I don't even look at the numbers. My mom texts me the numbers every single day, dude. You guys all know my mom. And she texts me the numbers. And I don't even respond because literally the numbers 5 or 50 mean nothing to me when they give it to me because they're just not giving us information. When they just give us the positive cases, all it does is it creates either more questions, more frustration, or anger. Because, oh, what are we going to do with the cases going up? Okay, what does this mean? I need more information that can help protect me, my family, others around me. I want to know if you're telling me there's 50 cases, tell me how many of those were vaccinated, unvaccinated. Of those that were vaccinated, let me know how many of those ended up in the hospital, because that can show some of the non-believers and naysayers that, okay, this protection with the vaccination, reducing the severity, is gonna take away from overwhelming our hospitals, our healthcare, all those type of things. Now, if you're
Well, you
unvaccinated, like we've seen, 95% basically is going in. It's showing, okay, we need to try and work on ways to minimize the severity of everything that's involved with freaking COVID-19.
well, you're gonna be. I mean, I'm blown away with what just hit the wires now. It just came on the air. You saw that, Mel?
No, I didn't.
Oh my God! I mean, whew. Well, I'm just gonna let you know.
Share it.
There's all brand new shows on Netflix. That's what I was looking at. Netflix.
I knew it. I knew it.
I had a feeling.
I knew it. I knew it. I thought when his phone went up, I thought he had just gotten a text message from the lieutenant governor. That's what I thought. You mentioned the testing. You mentioned the testing, Tyson, and you know, I think the reason you guys are doing an excellent job. 0 cases since you guys opened up. I mean, that's amazing. But now we are faced with a system where you don't you can come in with a vaccination card. You come in with a vaccination card, or you take a pretest, or you just say screw it and I'm gonna go on quarantine. And they all know by now, because of social media, that no one is checking quarantine. Obviously, there is no one enforcing quarantine anymore. How bad in your, and I was saving this question until the guy from Aqua Palms came on, but it doesn't look like he might be coming on. I was going to ask the two of you, because one is on Oahu, one is here, but I'm just going to ask it to you now. Is you said you never was against testing. How bad of a hit do you think the visit industry would take if we reinstated the pre-travel and a post-travel, even if we didn't do a 14-day quarantine, whatever, but a post-test of travelers, not just visitors? How much of an impact do you think? And let's just, for full disclosure, we're talking about the Grand Hyatt. We're not talking about an economy hotel, so it is different. I acknowledge and I accept that. And I did call a few of my friends who run the smaller hotels. All of them are camera shy. They don't want to come on. I don't blame them. But what do you think about that? About, reinstating the testing for safe travel? I call them the unsafe travel program.
First off, it would take a hit. The hit would be determined on what type of quarantine would be mandated for the post-arrival test. And this is what I said this from the get-go, is if you do something longer than 3 or 5 days, I said, nobody's coming. So choose a different island. And like somebody said, first off, we do this kind of crap. Do it statewide. Don't make one island choosing. Do everything freaking statewide so that everybody coming to Hawaii understands what the hell is going on. Don't let the mayors decide what we're going to do, and then it's a piss war as to who's going to look better. Just make the entire state do it. But if it exceeds more than 5 days, nobody's coming. Like for us, most, and I think I might have saw with HTA might have been, they said the average stay for a transient traveler coming in is 5 days in the state. So if you got to spend your entire 5 days in quarantine, nobody's coming, right? Like you said, at our hotel, we might get some to say, I'm coming. We can go to the Grand Hyatt for 5 days. We're going to be at the pool, blah, blah, blah. They might come, but nobody's coming. I wouldn't go on a trip. And we're going, but people still got to realize, and once again, I'm saying this, working in hospitality industry where I need people coming, you're traveling during a damn freaking global pandemic still. It's not the same type of travel ways that you had prior to 2020, right? Things change after September 11 attacks. Now you got to go to the airport 2-3 hours before. Things are going to change now when you travel because of COVID-19. But it would definitely take a hit. Like I'm not saying we'll go back to zero, but if everything would be predicated on how long is that quarantine before you can test out or take that post-arrival test.
Well, we know with this variant, 3 days, the virus starts shedding in 3 days, possibly 4 days. So I mean, the quarantine would have to be at least 3, possibly 4 days. And and again, it's not quarantining them in a room. They're free to roam.
Yeah,
I mean,
around
I
the
mean,
property and whatnot.
my question really, my point, I guess I'm trying to make is that we gotta have some sort of testing, and I'm talking about right now. Yeah, we want to stop the spread of this virus that is on fire. I'm not talking about 6 months or a year. I'm talking about right now, for the next 2 weeks or 3 weeks. We gotta stop the spread of this virus, and we cannot. Do you believe 2%? And this is, bro, this is totally, like I said, unrehearsed. 2% of our visitors are the only 2% are actually has the virus.
Hell no. That's horse crap again. Fuck no, man. Because it's the same thing, right? People coming in and once again, I read what people say. I agree. People coming in, wait, let's go. Non-residents coming in aren't gonna test unless they feel sick. Flip it. Residents coming in aren't gonna test if they feel sick. So if it is left to your own personal discretion, nobody's gonna test, right? Nobody. You and I had conversations about this before. People don't like. Um, I don't like saying blaming residents. People don't like holding residents accountable for their part in any type of spread. But keep in mind, we know the same way someone coming in who not gonna test until they feel sick. You get people who leave, and this is before you could opt out of any quarantine if you got vaccinated, right? We had people who left who, instead of spending the $150 for the family of four, I'm not gonna spend the money. I'm gonna just go back home, quarantine for those 10 days, and then go about my business. And unknowingly, right? Nobody brings it back intentionally, but unknowingly came back, was positive, did their things, spread it to family members, and boom, next thing you know, we get positive cases. But yeah, if you're gonna leave it to people on their own to go test, most people ain't gonna test because it can either ruin your vacation, or for those returning, it's gonna make you stay home a lot longer before you can go back to work. So, but yeah, no, I'm all for testing. We, like you said, we got to do something now. It's the same thing with the vaccinations, and people can get mad at me. I never think that the federal government should ever tell any individual you need to get vaccinated. Hell no, that is your choice. But if an employer says, I want you to get vaccinated or you test every week, make a choice. Because guess what? I said this earlier, in order for businesses to be operational, they need to be open to operate. And if you can't trust or depend that your staffing is going to be at the levels where you get to open and operate and make money, why have you on? So you make a choice. You either get vaccinated or you don't, and you subject yourself to a test every week, or you decide if you want to remain employed or not. It's I don't know, I have no problem if you're not required to be somewhere for a business to have requirements for your employment.
I will say this, and Mel, and you've seen it, T, when we've been on the show. My pet peeve has always been, how is the message said and made, right? How is the message given out? Because this news has always been doom and gloom, but I think it could be better prepared. It's not so much, it's like, how much punishment do you have to give a person to make them understand that this is really bad? Because it gets to a point, they're so resistant. They become resistant of doing the right thing only because of the messaging, right? Or actions that's taken by the government. Because people freely will do certain things. They just don't like taking orders. And when you give them an order, they say, more, I'm not going to do them, right? Then you just leave it to the point where, well, this is the bad thing that can happen, but hey, take care, brother. See you later. And then when people start dropping like flies, then that's when like, hey, you know what? I think we better do something because man, this is getting hairy. The more I've been watching, the more orders that the government has been giving the people, especially of our state, the more resistant the people are getting. And yet they know because we're in a state where we don't have highways that connect us to another state. Our hospitals, we depend on our hospitals, but we don't have enough staff. Everything has to be imported. There's nothing that can be driven in.
Yep.
And so look what happened. I'll give you a good example. I was supposed to get company vehicles close to the beginning of the month. Never happened because for some reason, and rumor was someone got sick, had COVID at Young Brothers. Well, whether that's true or not, but what did happen is nothing was being brought over. So there must have been some truth to the matter, right? Nothing was being brought in. And to me, that was dangerous in and of itself. So we have this protection when the ILW has a West Coast strike, right? They leave Hawaii alone because Hawaii is dependent upon shipping. But I tell you, there's no protocol if a shipping line, someone gets sick and you shut down a shipping line, there is no safety. There's no safety net. And guess what? We were affected by it because living in Waimea, I felt like I was in a third world country. I go into Big Save, nothing on the shelves. Even the meat, you know the meat? A lot of it was gray. Yeah, it was gray meat. I guess that was a new breed of meat they were selling that day. Gray meat. But it's not their fault because they're held hostage like anybody else. You rely on the shippers.
Oh, I completely agree.
Thinking out loud, yeah, because again, obviously, I am stuck on the unsafe travels program, and I've been thinking about what you were saying about the average stay. Now, everything comes with a price. We know this, right? We also know that there's millions and millions and millions of dollars available for testing, but I understand because I wouldn't, man. I wouldn't go to no trip if I had to stay in a hotel for 5 days. I just wouldn't do it. Maybe the Grand Hyatt, though, I might, because you guys have enough things to keep you busy over there.
Hey, or Mel, we're in, the worst thing, you got the Grand Hyatt for 5 days. Just come to Valley and talk story. That's all you
Yeah,
gotta do.
exactly. That's
Right.
my point. I mean, I might do that, but at $900 and $1,000 a night, it might be a little rough. But anyway, what if we would require, in other words, and again, I'm just thinking out loud, no quarantine, right? There's no quarantine, but every day for 4 days, you got to test. Every single day, you get a single use room key. Every day before whether before you leave or you come back, you get tested. And no, don't start going crazy, guys. I'm just thinking. I don't think the governor's got the cojones to do another quarantine with a test. But
No, this is what's going to happen now. To go on your point, I know exactly what you're going to say. And guess what? You're going to get this knock on the door. Aloha, room service. Door swings open. Right then and there, sister with a swab. Right in the nose.
Yep.
yeah. No, I mean, so and while people are going to say, yeah, but they're still going to be free to go around. But yeah, they're going to be free to go around for a day. Right? One day. Every day they get tested. Every day. Once they hit a positive, guess what? Quarantine. You're going to go to the beautiful quarantine center. But every day you get tested. Every single day you get a rapid test. And these things apparently, from what I'm hearing now, is $20 a piece, and that's just going to be a fee.
Hey, Mel, I'm going to tell you right now, if that was to happen, choke people would still come to the island.
Right.
Because people not going to be mad. Let me go take a rapid test, whatever it may be. Let me go take a test and I can still go on my way after get negative because you're not taking away from them, right? You're taking what?
Right.
15 to 40 minutes out of your time, depending how long it takes, and you get it back, right? And then, hey, let me make a point out too. When I said the average person, so I said transit, I don't consider people that go to any timeshare and any of that as a normal visitor. They're basically part-time renters. So if they got a quarantine for 10 days That is freaking nothing. That's to drop in the bucket. Oh, 10 days. All right. I'm here for 45 days. All right. I got 35 days to go around. Right. Feel like, so
But
I don't
if
consider anybody who can come here for 30 days as a vacationer coming to Hawaii.
this is what I think. I think if we do the pretest, we're going to reduce the influx of virus by a small percentage. You know, people will test
and
positive,
no,
and they,
no. Oh, sorry. Specify you taking this pre-test, vaccinated or unvaccinated. No matter
everybody
anybody coming in, you take it.
everybody gets a
Yeah,
pretest.
everybody. You're not getting no vaccine
And they're
passport if you
talking
implement testing.
about removing the vaccine exemption and making everybody pretest, but the pretest is not enough because we still got a lot of people coming through. But once they get to the island, you test every day. For 4 days, you test every day. And on your fourth day, if you get a negative, then you get the room key that works every time. But until then, you get a single use key, and you cannot get into the room. When they come in, hey, I lost my key. Your front desk will check the thing. If they're tested, they get the key. If not, they got to take a test. I can
Yep.
tell you, if we did that, we would identify a huge chunk of positives, and we could address them. And then you know what? The day before they were negative, they weren't shedding disease, right? Today they test positive. They can remember most of what they did in the last 24 hours, where they went, what restaurant, what park, what beach. And I think that would be a very good compromise for our leaders who are afraid to step on the unions, or I mean the visitor industry's toes, and piss off all those guys at HLT and HTA. This way, you still have it comes down to a choice, right? If you want to come enjoy Hawaii, you will have to take a test, and you'll have to pay for that test for 4 days. But you're still free to move around. They're doing it anyway, and now we have no test. So I think that's a brilliant idea, only because I freaking thought about it, but it'll never happen. But I know, hey, Gov, I know you watching. Josh, I know you watching, or one of your staffers. You can have that idea. I will not claim ownership. Josh, you can come up with that idea, and you can take all the credit because I'm not interested in credit. I'm telling you
Dude,
right now.
I was just gonna say that before you said. I said, you know they're watching. They can take credit for that. Just do it. Like I said, it can be done. Like I told you, I get irritated sometimes. At point pissed off is where shut things down, stop tourists, blah 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 blah. It's not just tourists. So if you're gonna shut down any industry and you want to hurt hospitality and people who work restaurants, hotels, whatever it may be, tour guides, shut down everybody. Don't make us be the sacrificial goats yet again, because it's not just non-resident travelers coming in that's helping cause the spread of this virus. So when people say shut it down, that's bullshit. You don't just shut down a certain individual. Now you're discriminating against us. We didn't do anything to you. So if we're gonna all be in this together, let's all be in this together. We're gonna suffer. Let's all suffer. But don't just say let's shut it down and then tourism. Any of you operating there, you go, because we've got to figure out ways to not just coexist with the virus, but figure out ways that we can still do it and maintain some sort of safety level that's not going to hurt us. But yeah, that was my low thinking, Majiki.
Okay, I guess right now in Lawai, wherever the heck Rhonda lives, they're 1 hour time difference because it's 8 o'clock and she was supposed to come on at 7.
She did text me at 7:40. Some said, "Damn it, I'm still at work." But then again, looky there. Ooh, it's overtime tonight.
Overtime. Hi,
Well,
I just want to jump on and say hi.
Hi, we ready to get vaccinated? Let's go. Dr. Capono is ready, willing, and able.
And
gonna
he's
wait.
right outside your door, by the way. We gave him your
Yeah,
address.
he should be there. He should be. Capono.
He actually does live 10 minutes from here. Well, not even 10 actually.
So what's up? What's up, Rhonda? I know we got a few minutes left, but what's going on?
Yeah, no, good. I was listening to Tyson talk all the way home. Holy crap. I actually thought about stopping at Kukiula Shopping Market and like doing live from there. And then I was like, maybe not. Might have too much people without masks, and I didn't want to really go up to them and then hand my phone over to really get an interview. So, but I thought about it. I was like, hey, let's go do a live from Kukiula and see all these people walking around.
Yeah, well, again, it's hard. There's very little enforcement right now, and that's part of the problem. But I mean, it's there's so many problems that are happening. There's so many things that's got to be fixed. And again, I still, and it's hard because, like Tyson said, you can only control what you do. You cannot control what others do.
Right.
But for all of us that are concerned, and some are not. I totally respect everybody's opinion, but if you are concerned, then you need to take personal responsibility and do what you need to do to protect yourself and your family. I've been saying that every night. I'm sure people are disgusted with me saying that, but we can sit on Facebook. I remember when somebody had posted something on Facebook, and I posted back. I said, Facebook doesn't do enforcement, so you can post all the pictures you like about a group of people not wearing a mask. Facebook does not enforce. So
wait, I thought there was Facebook police. I always had Facebook police on mine.
They are only if you say something wrong, but they don't enforce the mask mandate. So all the pictures you post you just get people more aggravated and irritated. And like I said, if you come across somebody no more mask, no go near them.
Exactly.
Don't go near them. Just don't go near them.
And tell them to back up. It's okay. But yes, I heard Tyson cover stuff, so I just want to stop in and say hi. And I'm sorry, but now it's I got my days mixed up. I thought I was done at 5 today, but obviously I wasn't. So
you're just getting old. That's all it is, sister. It happens to all of us.
That is true. That is true. Don't forget, my birthday is next month. I expect presents.
62, you can retire.
What day? Rhonda, what day is your birthday?
September 19th.
Okay, I'm the 5th, so we can swap.
Oh yeah, that's right. Yeah, you're the 5th. Yeah. And the 19th.
Right? Labor Day, right when the mass is going to be coming in, and the picnics and the camping and all of that. So
hey, well,
we can have a COVID safe, only us birthday party.
Okay, shoot, you can be in Kalaheo and I'll be in Wailua.
Yeah, exactly. We'll have a birthday show.
I do want to respect you guys' time as well as our viewers, so I will give you guys an opportunity for some closing thoughts about what's on your mind, and we'll wrap it up. Rhonda?
Rhonda, go for Rhonda.
I'm opening and closing. I really have nothing. I appreciate everybody being safe out there, and for the most part, everybody respecting each other's opinions on the whole matter. That's the only way we're going to get through this, I think. And that's really all I have to say. Could say more. We'll be on here another hour, but it's okay.
Yeah. And we will, the next time Rhonda will be on, will be when she gets her shot, her vaccine, live with Dr. Kapono Chong Hansen.
Yes, I promised Dr. Kapono that if I get the shot, he will be the one that does it.
Yeah. So. And he's ready. Tyson Moises, coach.
It's kind of similar with her, what she says, right? Everybody's going to have their opinion, their thoughts, but understand everybody's going to look at this a little bit differently, right? I said this a few months back, probably more than that, when I was on one time. People, the way to look at this pandemic is through basically 4 lenses. Employed, unemployed, personally got affected by this, either themselves, a family member, a close one, or the 4th one, people just don't give a shit. Right? And now we're seeing a lot more of those ones when it comes to masking and vaccines. But my thing is, if we can all just worry more about ourselves and what we can do, and stop worrying so much about what everybody else is either doing or, more importantly, not doing, I think we can, minimize a lot of the things that's going on. So besides that, I always love talking with you guys. I'm glad when I come on, I get to kind of get out of my shell, burst my bubble, and just not be normal, because normally I just hide in the corner and just read novels and whatnot.
He actually just hopes that somebody is actually listening to him.
I got Eden next to me, so
even Eden agrees. Hi.
Yeah. Bye.
Charles.
Yes, sir. It was very interesting tonight.
Hi, Uncle Charlie.
Hello, dear. Well, what I got to say is this: we just got to continue to be safe. On a serious note, continue to be safe. Do what we can. Um, can't control others. That's so true. But yet, what you can do is make it known to others if they decide to invade your space with their nonsense. You can just tell them, hey, cease and desist. If not, don't resist. Don't resist. So you can do that and just let them know that, hey, because, I see it a lot. And, I spoke to someone today who said they just came back from California and that it was really, really tough because this individual felt like they were the only ones there using a mask and everybody else wasn't. And I said, I know the feeling. You're going to territories and that's just how it is. But the main thing is you had your mask on. So if the virus was to present itself right then and there, you're gonna better chance of not getting it as opposed to them who weren't using a mask. So my closing thought is thank you to Tyson, thank you to Rhonda, and thank you to all of you for joining us tonight. Appreciate it, but do yourself a favor. Just err on the side of caution. That's all we can ask. Mel?
Thank you, Charlie. I did want to, Sam, Leandra, Julian just posted, today my daughter, Ipo, and her family tested positive for COVID, including my great-grandson. She took the baby to ER 40 minutes ago. He is just 2 years old. So again, guys, another shirt tonight. The prayer changes everything. Let's pray tonight before you put your head on a pillow, not just for Sam's Ohana or Leandra, but for all that's going through COVID right now. Come on, guys. We got to band together, no doubt about it. I know a lot of you have been asking about my daughter. I appreciate you guys checking in. Still got the symptoms. It's still considered mild symptoms, but she is monitoring and in contact with the doctor on a daily basis, checking her oxygen constantly. That's always the concern, but she's hanging in there. So I appreciate you guys' prayers and you guys checking in. I see Dana again. Mahalo, Tyson. You say it so well. You say it so. I think a lot of people, including myself, because Tyson and I wouldn't say we talk every day, but we talk or text frequently, but we never had a discussion like this about what it's like for employees. And I thought tonight went very well. I think a lot of people saw the different perspective from the visit industry side. We all do not want to see a lockdown. We do not want to see shutdowns. We don't. But if we do not do what we need to do, and I'm talking about we as a leadership making decisions, then it's inevitable. And I don't care how much of you don't want a lockdown. At some point, when we no more beds, it's going to happen. And it's going to take all of us to make sure that doesn't happen. So with that, folks, I know tomorrow night I talked about bringing my son and my daughter on. If she's not better, I'm not going to bring her on. She wants to share a message, but I'm going to wait till she's much better. And if that's the case, then, we'll probably take a break tomorrow night unless some developing story happens. And again, it's getting tough to find people to come on simply because everyone is busy. But appreciate you guys always. Thanks for joining us tonight. You guys stay safe. God bless. We love each and every one of you. Hey, by the way, you guys saw the Checkers and Pogo special the other night? Classic. Anyway, aloha.
Shoots them the kind.